Hi there, my name's Damian. I'm a Paediatric Emergency Medicine consultant at the Leicester Royal Infirmary. It's difficult this time of year when there are lots of bugs going around, lots of coughs, colds, and fevers, that if you've had a child who's had Kawasaki's disease, you're worried when your child has a fever again, could this be the disease coming back? So there are a couple of things to note. The first is that recurrence of Kawasaki's disease, i.e. it coming back in your child, is really uncommon. Less than 5%, maybe less than 3% of cases will come back to the same child. Now, the other thing to note is that you know your child best. And actually, if your child does have a temperature, they're feeling a bit miserable, you should be able to use the sense that you had when they were last unwell with Kawasaki's to benchmark whether this is likely to be a more serious disease. Generally, children who have a simple viral illness, i.e. something that will go away in a couple of days without treatment, yes, they may be a bit distressed with a fever, but it should respond well to paracetamol or ibuprofen. And certainly over a couple of days, you should find that the child waxes and wanes. Yes, they're a bit unwell, but then they go back to being well again and running around. Whereas in Kawasaki's disease, generally, the child is described as miserable to the extent of being irritable, is always unhappy. And that's a good yardstick to use to decide whether you need to seek more help. If you are worried about your child, then you should try and visit your general practitioner or phone 111. And sometimes for very simple things, if you're really unsure if that's needed, you can go and visit your pharmacist. If the child's fever lasts for 5 days or more, you should always seek medical advice as to what to do, because there may be a treatable condition there. Having said that, the vast majority of temperatures over the winter period, even those that last more than 5 days, are likely to be a viral illness.